Hi, I'm Bob Matchey, the Executive Director of Prime Plus Senior Centers, and this is Prime Time with Bob. And I'm with two fairly new friends, but boy, do they have information that they can share. Carla Thomas from HQI, how you doing?
Hi, Bob. Good to be back.
And Cindy Werner, also with HQI. How you doing?
Hi. Hi,
We're
Bob.
talking about drugs today, and the use of and the misuse of, and the abuse of.
Absolutely. And we want everybody to be healthy, happy, and safe.
There we go. That's what it's all about. Carla, tell me, what is HQI?
Well, Bob, HQI stands for Health Quality Innovators, and we are a healthcare quality consulting organization. And Cindy and I work on a large Medicare project from CMS. And our work involves working with community providers like hospitals and nursing homes, home health agencies, community organizations like yours, and area agencies on aging and pharmacies, so that they can all work together to help make care better for people on Medicare. And we're really excited that part of our work really involves safe use of medications, especially opioids, that we want to talk to you about today.
Carla, I want to talk about how we met, because we met online.
We did through a Zoom meeting.
Presentation, kind of a virtual meeting, sharing about Prime Plus's approach by doing it through community. Because so often, especially when we talk about opiates and other medications or medical treatment, it seems like for a senior that may have 4 or 5 different docs, they don't work together, or it doesn't make sense. And yet there is this infrastructure of kind of bringing healthcare together, right?
Well, more and more across the state, there are local community efforts through health-related coalitions. And we met in a meeting, on a Zoom meeting, during the Hampton Roads Care Transitions Coalition. And that coalition is a number of providers, like I just mentioned, trying to work together to make sure that anyone who goes to the hospital doesn't return back to the hospital unnecessarily, that care is safe, and that there's good communication between people taking care of patients, so that they could stay at home and be safe and have really the best care possible.
You know, one thing I've noticed, Cindy, over the last 6 months is the focus has been on COVID. Everything is COVID. But life delivers bad hips, other ailments that medical science can take care of. So it's not just about COVID. So we are not going to talk COVID today, right?
We are not going to talk COVID because there's lots of things occurring outside of COVID that have always been there.
Yeah.
And I think it's important to not forget those things so that we stay on top of that also.
Yep. Now, my crack research team opened an email about a half hour ago. And there's something really cool in there. It was an email from you, and it was a PowerPoint presentation, which we've got connected with this video. And I discovered some things that I was all wrong on about I come home from the docs. He's giving me some painkiller, opiate. Number one, oh my goodness, I'm going to get addicted. I mean, that's the first fear I had.
Right.
So maybe I shouldn't take it.
Well, I think it's important when you're working with your physician, and I can't stress this enough, you are an individual, Bob, and a very special, fun individual. Each person listening, you are an individual. And when you work with your physician and they prescribe something for you, you need to have the trust that they're looking out for you. But you also need to understand that you have a part of that, being a part of that team too. So feedback, questions, concerns, you mentioned a fear, that would be the first thing. If your doctor's going to hand you an opioid prescription, Dr. Smith, I might be a little bit nervous about this because I don't want to get addictive. And let Dr. Smith explain. Or say you forgot, or say you wanted to get home. When you go to fill that prescription, your pharmacist, I don't want to get addicted to this. And I've heard so much concern. But in the same sense, we each have an ability to have an impact on this opioid crisis. So it deals with both safe use and safe disposal. And that was the PowerPoint program that was put together to try to help those of us that are up in years realize that we can have an impact on this. We can do something.
Now that PowerPoint is connected to this, but please listen to what we're talking about, then go to the PowerPoint, right?
Absolutely. Don't go to the PowerPoint now because you don't want to miss anything that Bob is saying because it's important.
Well, I don't know. I'm just asking the questions because just because they give you a painkiller doesn't necessarily mean it is an opiate though, right? I mean, not every painkiller is an opiate. So what makes it an opiate?
What makes it an opiate is actually the risk for addiction, a narcotic, and a drug is categorized that way. But there are other options for pain treatments or pain management that are not opioids. And once again, that's something to discuss with your healthcare team. Could I get away with, if you're uncomfortable or nervous, is there another option? And if they say no, then once again, there's that trust. But maybe there is another option. Could be exercise, physical therapy, Tylenol, ibuprofen. But once again, that's something that's important to discuss with your team.
Okay, whenever I've had opiates come into the house, it's been a full prescription. They say take it for the first 24, then take it as upon needed. And so you try to wean yourself off of it, which means there's always some left in the bottle of the jug, end of the bottle. There's a good chance I'm going to need it in the next year or so, so I put it up in the cupboard. Should I?
Absolutely not. And I know that's going to be very hard.
Wasteful.
I know that's going to be
not or something like that.
Well, it's going to be very hard to not keep it. But the statistics have shown that over 50% of the people that have become addicted and become a part of the opioid crisis received their first pill from a prescription that was given to them by a friend or a family member. So remove the temptation.
Because I want to help my friends.
Right, but you also don't want to hurt them. And you don't know whether or not you're going to help or hurt them.
Yeah, I did not go to medical school. I will admit that. So you're telling me to get rid of it. But I can't flush it. I can't put it in the trash. I can't do this. I can't do that. It's a pain in the neck. But in this PowerPoint I just read, I can do some of that stuff.
Absolutely, you can. And there has been work by both the federal drug, FDA, Federal Food and Drug Administration, as well as the National Boards of Pharmacy for safe opioid medication use. And I know, and we're not supposed to mention COVID, but I just have to say here, because of what we're going through, the National Drug Take-Back Days, they usually happen in April and October. And the April one was canceled. But actually, on this PowerPoint, please go and look at it. There is a list of narcotic medications that can be flushed. And they have decided, based on the crisis that we're dealing with and the overdoses and the deaths and the addictions, it's better to flush some of them. There's also information if the medication is not on that list, a safe way to discard it or dispose of it. And it can be as simple as using coffee grounds or kitty litter. And there's instructions on how to do that. So the important thing to take away from is you as an individual can have an impact on addressing this crisis. And if every individual out there would consider doing that, man, we'd have a whole army working on this.
You know, you're kind of creating a theme here of you're empowering the patient to be part of their medical care. I mean, right, Carla?
It's so important because we really encourage providers to enable the patients to be part of that conversation, but we really want to encourage patients to be prepared with any questions when they visit their doctor. Include the pharmacist every time they fill prescriptions, or even in between prescriptions, to ask them questions, because they're there to help. Yeah. And like Cindy was saying, everybody reacts differently, has different combinations of medications and different situations. So it's really all about being safe and making sure that those medications prescribed are doing what they're supposed to do. But we certainly don't, like, when Cindy was talking about the disposal, different meds, different kinds of disposal. So the education, the link to the education program that we're talking about can really give you additional information.
And this is probably the time for me to confess, because I'm one of those, I'll go to the doctor, he's got the degree, and so I'll do what he tells me to do, and then I'll get home, my wife will ask that multiple questions that I forgot to get answers for. And she's one of those, she does her homework. I mean, and she's one that'll say to her cardiologist, I don't feel comfortable taking that medication. And she makes them work for it. But because of that, she's part of her healthcare. So I admire her for that, and for a bunch of other stuff too. But
if you can't, I'm sorry.
But she was raised to hold on to things.
Yeah.
And not toss them. So this is new. Now, one thing, Carla, I noticed that in that survey, there's a survey as part of that PowerPoint. So you really do care what I think before I get educated and after I get educated, right?
Sure. We want to make sure that the information that is provided in that training is useful, and that it's helpful, so that it helps us create other training programs.
So we have less than a minute to say, read the survey and participate, right, Cindy?
I was going to say that, and also just my one last comment very quickly, you can be a part of the solution.
Mm-hmm.
Yeah, and boy, does that
sound sure to like
times.
And make sure to like this program so that we can do more.
That's right.
Yes.
Because I want to be able to be like Sally Fields. They like us. They like us. Thanks a lot for being good sports and coming on. But it's important to know what your healthcare is all about, and you are a major part of that journey. Thank you. Take the survey.
Thank you. Thanks for having us back.
Thank you, guys. Thanks today. Have an awesome rest of the week.
Thank you, and keep in mind, stay safe and stay connected. Thanks a lot.